You are professionals. Good morning. You are professionals. Okay, you are professionals. You are professionals in your field. You are professionals. Absolutely. Absolutely. You are a professional in your field. You are a worker in your community. You are a leader in your church. You see the issue in your community. You see the issues to your members, to your congregates. And you're losing money on top of that. You're losing money and resources. People are not coming to my church. Guess what? I'm not going to get donations. Okay, so it's also affecting the church as well. I went from fat to cute real quick. It's also affecting the church as well. As well, you damn right, it is affecting the church. Because a lot of these pastors are going to be losing their 501c status real quick when they do not show results to the government of what they're doing. If they do not prove in action, in words and in deeds of what they're doing, if they're not proving to the community and providing resources to their community, yes, they will be losing that tax status real quick, real soon. If they are closing their doors, they will be losing that tax status, that 501c church tax free status real quick. Yes, they will be. So there's other issues that we need to address as well. It's great to have unemployment claims. It's great to be able to have to provide um, uh, financial incentives for nonprofits, for community organizations. That is great. That is great. That is wonderful. But again, we need to address this on a fact level basis instead of somebody's agenda or somebody else's opinion about how they feel about an issue. What is the facts? What is for real? What do the findings show? What does the science show? If you do not show evidence to your community of what you're doing, you're going to be losing that tax-free status. If you do not show evidence of how you are helping your community through a global academic crisis, you are going to be going to jail because you are harboring tax-free funds. Okay, so there's a lot of other issues that need to be addressed as well. That is a fact. If you do not show to your constituents that you are providing leadership and providing goals, working in your community, doing something with the money that resources that we're giving you, and you're using those resources and money for other issues as well, you are going to go to jail for it. That is a fact. If you do not prove to us what you're doing, you're going to be, punished for it. It doesn't matter who you are. That is a fact. That's how I feel about the issue. That is the truth. Okay, so you need to address this on a more social and a fact-based level, and stop trying to push somebody else's agenda across of it. Especially when you are going to continually promote a drug to the American population that is used for a parasite disease. Get your facts straight. Instead of you promoting a drug, have a health official promote that drug. Do you guys understand what I'm saying? A president should not be promoting a medication. It should be a health official promoting a medication. A president should say, I support this medication. He should not be promoting it. It should actually be a health official on TV, on live TV, saying, we support the initiatives, we support the research and goals towards this new medication, this vaccine. We support this vaccine research. We are health officials certified and board certified by our local communities, by the Centers for the not for the the board of the American Board of Physicians, as well as the American Board of Certified Pediatricians, to know that we are come together. And usually, if it is a certified clinician, if it is a certified medical person, okay, I know who they are. If it is a certified doctor, board certified physician, they are doing everything. They are coming together as a group. So that person represents a group of people. He doesn't represent just himself, he represents a whole board of people. So when a doctor comes on national television to the American public, he comes together as a representative of a group of highly qualified doctors and clinicians to say, clinicians, I'm not talking about family doctors. I'm not talking about your local doctor that you see at CVS or your local nurse. I'm talking about actually uh, laboratory scientists. I'm talking about doctors that have published work, published findings. I'm actually talking about researchers. That's a clinician. Those are clinicians. I'm talking about researchers. I'm talking about laboratory scientists. I'm talking about doctors that make publications for students to study off of. That's what I'm talking about when I talk about clinicians. It's insulting. It is insulting. It is insulting. We don't want you there. We don't want you a part of what's going on. It is insulting. It is insulting. Either they don't want people a part of it, or they don't want the American public to know what is really going on and what the agenda is behind it. It is insulting. Okay, so again, usually if you have a medical professional, usually like somebody like Dr. Fauci or Dr. Tedros, they don't just come by themselves. They represent an organization, especially people like Dr. Tedros. He represents a whole worldwide global organization of people from all parts of the world, countries and continents, all parts of the world, to say whatever Dr. Tedros is saying has been approved and has been accepted by doctors and other organizations all around the 5 continents. So Dr. Tedros doesn't just represent himself, he represents all 5 continents. So when you refuse word or when you refuse research scientific findings from Dr. Tedros, you refuse scientific evidence from all 5 continents of the world. Literally, it is that bad. And that's what the American public is not understanding. Why? Because if the World Health Organization has approved it and has denied it as such, that means not only that they have approved a finding or they have denied a finding, but they have been through the same issue before, because it is a World Health Organization. The different parts of the world have been through the same thing before that America is just not find out that's new for America. So if it's new for America, America doesn't want to accept it. We don't want to accept your evidence. We don't want to hear what you got to say. We'll do things on our own way. We'll do things on our own terms, but you can't do that. You can't do that. America needs to wake up and think outside of its own borders and to stop accepting its nationalistic ideals. Hey, hey, Melvin. Hey, Kim. Hey, George. Okay. America wasn't built on a nationalistic ideal. It was built on a whole wide world ideal for people to come into our borders, a very either low class people coming here for to get equal human rights, or people to come in here and to spread their knowledge, to get research, to get the education here in America and go back to their home countries, get the resources here in America and go back to their families and use the resources in their own countries to build up their communities. It's a network. It's not a nationalistic network. It is a global, worldwide communication network. Okay, so there are other issues that need to be addressed. Okay, absolutely. So when you refuse the findings and the scientific backed up evidence of the World Health Organization, you are saying we see the pictures, we see the people that have died from this own same virus 5 years ago in a different part of the world. But you know what? Because it existed in a different part of the world and existed in America, we don't believe that. We don't believe that it happened before. We don't believe it because we didn't see it there, and we weren't there to see it with our own eyes. You guys see where I'm coming from? Is I'm generalizing it, but I'm actually making it finding as such. I'm actually making it reality. I have a liberal arts background. I have a philosophy, I have a math, I have a history background, but I can still use my liberal arts background to apply towards medical education and the medical field. I don't need a biology degree to tell me I can become a nurse to work in the medical field. I don't need a BSN to work in the medical field. I don't need a master's degree in nursing or a master's degree in nurse practitioner to tell me I know how to go out there and help the needs of my community. At the same time, I don't need a nursing degree to have a baby. I don't need to become a registered nurse in order to help somebody through a heart failure, a heart attack. I don't need to have a nursing degree for that. If somebody's going through a drug overdose, I don't need to have a doctor's MD license either. So there's a lot of other issues that need to be addressed. I don't need a BSN to tell me the community needs help. I don't need these. I don't need these extra credentials. What I do need to do is to check and make sure that everything that I'm doing is in exact the same on the same page as the rest of the medical community. So what if I have a liberal arts background? So what? But they still won't apply. They still won't stop me from getting to the other issues of the worldwide community. So what if I have a liberal arts degree and a medical assistant degree from a trade school? So what? What can you do about it, Melvin? What do you mean what can you do about it? You can ask people questions, you can figure out what people need. That's what you can do about it. Don't be blind. It's as simple as asking people. I mean, it is very simple because people try to take this whole COVID-19 thing into the extreme. They really try to make it extreme as possible, as much as extreme as possible. Melvin, what you have to do is that you, Uncle Melvin, or somebody else? What you have to do is you have to make it as simple as apple pie. You have to make this disease, make this virus, make this global epidemic as simple as apple pie. Go to your neighbors, call up your relatives, ask them how they're doing, what's going on. Are you okay? Have you been checked at the doctors? Have you been checked at the hospital? Okay, it's simple. It's real simple. It's real simple. Yeah, about COVID-19, Melvin, absolutely. You have to, it's pretty much as simple. You have to go to your neighbors, you have to go to your family, you have to go to your community and ask people around. First of all, you have to go to your community and ask people around on a community level. You have to ask people around on a local community level. And then, as that applies, then you have to actually go and update yourself in the media. What is the media is saying on a